You're listening to RX Inspiration, the show where we highlight pharmacists from across the country, making a difference in their communities. I'm your host, Mason Manuel, and I'm coming to you from the home of pharmacy here at the American Pharmacists Association in beautiful Washington, D.C. I'm joined today by APhA President Randy McDonough, who will be leading today's conversation with our very special guests. Speaking of, we have 4 guests today. First up is Melissa McGivney. She's the Associate Dean for Student Success and Professional Initiatives and professor at the University of Pittsburgh, as well as a member of the APhA Board of Trustees. Next up, we have Chichi Momah. She's the founder and CEO of Springfield Pharmacy and Medical Supply in Pennsylvania. Next up is Stephanie McGrath. She's the Executive Director of the Pennsylvania Pharmacists Care Network and Director of Community Partnerships at the University of Pittsburgh. And finally, last but certainly not least, we have Dan Longyhore, the System Director of Knowledge Management for Pharmacy at Geisinger. Now, those are some really big names, and we're going to pick their brains, so be sure to leave us a comment on what you want to hear today. Maybe shoot us a like and subscribe, and let's get started. Randy, take us away.
Thanks, Mason. RX Inspiration, which is an APhA series that was started when I became president, and the reason why I did that is throughout my career, I've been inspired by pharmacy practitioners that are in the trenches. It's those individuals in practice who are providing exceptional care to their patients daily, even when faced with tremendous challenges. My goal with RX Inspiration is to highlight pharmacists, technicians, and practice partners who are making a difference within their communities to ensure that patients' medications and health needs are being met. Perhaps these individuals started unique service. Maybe it was partnering with other providers or community organizations. Or perhaps it was just an extraordinary action performed by the pharmacy practitioner during their usual workday. Each individual, each interview, and each story will hopefully inspire all of us to practice to the top of our training, challenge the status quo, and help us to create our own destiny. And with that, I'm very excited to have the guests that we have today because they've got some exciting news about what's happening in Pennsylvania. Recently, Pennsylvania pharmacists achieved Medicaid provider recognition. I'd like to pass this on to Melissa if she could provide us with the why and the how Pennsylvania pharmacists achieved this recognition as a Medicaid provider.
Randy, thanks for having all of us today. As you're thinking about why to do this podcast and wanting to share stories, and we talked about it, I thought, we need to hear it from all the voices that made it possible. When we look at advocacy or change, it's never any one person. It's always an incredible team of people and a long history, usually, of how we ended up getting there. And so in Pennsylvania, anybody that's visited knows that we're a big state that really has diversity of cities and rural areas and truly everything in between. And so when we try to accomplish change here in Pennsylvania, we've learned we have to do it together. And so I'm so excited to have this team of colleagues that are throughout the state, literally representing 3 very distinct areas of our state. Each of them are incredibly passionate about the work that they do. And when it came to provider status in Pennsylvania, many states have been able to legislate changes of provider status. In Pennsylvania, we have a very large state, we have a very large legislature, and there was an opportunity with our Pennsylvania Medicaid leadership where they started looking at, we need to find a way to get better access to patients in our state. And they were looking at expanding the scope of work that practitioners could do, and it included pharmacists. And so here in Pennsylvania, our Pennsylvania Pharmacists Association, as well as our Pennsylvania Society of Health System Pharmacists, collaborated alongside of leaders from APhA and NCPA and came together to have these dialogues. And I'm going to let them tell you the story of the dialogue. And it really has always been about us coming together across our state. And our state associations really provide that road for us in partnership with the expertise of folks nationally. So I'm excited for you to meet my friends and my colleagues across the state, Randy.
Thanks, Melissa. It is exciting, and it sounds like it really did take teamwork for this to happen. So, Stephanie, I want to start with you. Tell us a bit about your current role and how you started working with Medicaid and how they engage you in provider status discussions.
Sure. Thank you, Randy. I appreciate the opportunity. So as the Executive Director for the Pennsylvania Pharmacists Care Network, my primary focus over the last 6 years has been to build programs in partnership with health plans that facilitate payment for enhanced pharmacist services such as hypertension and diabetes and asthma assessment and monitoring, medication management services, and social determinant of health assessments and referrals. And through these programs, we've had pharmacists at nearly 200 pharmacies across the state engage over 20,000 unique patients over the years. We demonstrated through this work that pharmacists could engage patients in high quality services and do so at scale. This data has been shared strategically with Pennsylvania Medicaid over the years, and it illuminated the role that pharmacists can play in the healthcare system and influence the recognition of pharmacists as providers with Pennsylvania Medicaid, along with the desire by Pennsylvania Medicaid to allow pharmacists in Pennsylvania to practice at the top of their license and in doing so, allow other healthcare providers to practice at the top of theirs. Melissa mentioned this coalition of pharmacists that have come together to meet with Pennsylvania Medicaid over the years. Dan and I sit on this task force under our State Pharmacy Association, and we represent multiple pharmacy organizations. And it has been this collaboration that has been absolutely critical, in addition to the data and the demonstration that pharmacists can do these things, and being ready to do it as well through the mechanisms of the association and of the network. And so, as again, Melissa mentioned, this movement was really about meeting the needs of Pennsylvania Medicaid recipients and the recognition that pharmacists play an important role in the solution to provider shortages across the Commonwealth.
Very good. And it sounds like you've, collected a lot of good data and evidence over the years to demonstrate to Medicaid. So it sounds like this became just the natural progression. Dan, can you tell us a bit about your current role? And you've had a leadership role in getting pharmacists credentialed through Medicaid as part of Geisinger. Can you tell us more about that journey?
Yeah, I'm happy to. I am extremely privileged to work within the Geisinger Health System to look at our pharmacists and to help them navigate the credentialing process. I fell into this wonderful role through some of my other responsibilities with the system, overseeing collaborative practice agreements for our pretty extensive network of pharmacists across hospitals, but also in physician clinics and specialty pharmacy and home infusion. And, kind of our mantra, even before we had, this ability to work with Pennsylvania Medicaid, was we tried to be integrated into that care network the best that we possibly could and really touch patients in every aspect of their care, whether it be inpatient or outpatient. And so when the move became available for pharmacists to be recognized as providers within Pennsylvania and work with Pennsylvania Medicaid, I got to learn how to navigate the credentialing process. And it was certainly many more steps than I thought it was going to be, especially when we use the word credentialing, because it means different things to different people. And so the credentialing process for me was learning not only how to navigate it within the health system, but also how to navigate it with our external managed care organizations so that the providers would be eligible. And so it led to a lot of different kind of learning opportunities for me and learning opportunities for our staff to know what that meant. So when we talk about credentialing from the health system standpoint, it was me working with our team within Geisinger that credentials all of our advanced practice partners, that credentials all of our physicians to get them through that process and get them, their promise ID with Pennsylvania, get their practice sites connected to them. So when billing went through, there was something in place. But then the second part is getting them credentialed with the MCOs. So 7 potential, MCOs that deal with Medicaid patients across Pennsylvania. And it's how do we get our pharmacist names to them, and how do we get them through the credentialing teams within the managed care organizations so then they are recognized providers within those managed care organizations. And to this date, we are managing that from essentially a one-on-one or an individual type process where we've engaged an external partner, CAQH, to help us with the credentialing process through each of the MCOs. We're working internally with our team to do it, but Randy, we probably have close to now 120 pharmacists within our system that we're attempting to get registered with Pennsylvania Medical Assistance. And our credentialing team is great, but when you throw 120 new names at them, that's a lot of, FTE time that they don't necessarily have to dedicate to that. So until we can come up with solutions for that, my role in this is helping our pharmacists A, get their names to our credentialing team, but then B, also enter into and maintain their profile within CAQH. So as they start to work with the different MCOs across the Commonwealth, they can be recognized by them as providers, and we can continue to bill for the services that we're offering.
Excellent. I'm familiar with their credentialing process myself, but not with 7 MCOs. And so that's going to be a challenge right there. So thank you for that background. Hey, Chichi, you own your own pharmacy, and like me, and have been an advocate for your patients in the profession. How has Pennsylvania Medicaid provider status impacted your pharmacy services?
Thanks, Randy. Thank you for this opportunity. And I'm going to tell you, I'm not only going to speak for myself and my pharmacy, I'm going to speak for other community pharmacies here in Pennsylvania, right? Because it takes a village to accomplish what we have accomplished and where we're going, right? And listening to everybody speak here, especially Stephanie McGrath, because she leads our Pennsylvania Pharmacists Care Network, which is a clinical portion of our Pennsylvania Pharmacy Association. And initially, for years, when they have us do e-care plans, knowing that we're not getting paid for them yet, but we still do it to kind of change our mindset and start to evolve out of that traditional mindset that pharmacists are only dispensing pills and getting into the clinical mindset of documenting what we currently do, and actually ensuring that each and every one of us understand that MTM is a service that we should document. Diabetes education, hypertension education. I mean, we were using SNOMED codes. Some pharmacists were getting frustrated because we're not getting paid for them back in the day. And then we got the payer program with one of our Medicaid payers to actually get paid for it. So we had to, it's a process of evolution, right? And it takes patience, it takes perseverance, it takes dedication. And to get to where we are now, where we can still do the same thing and now we can bill for it, it's like finally getting recognized for the smarts that we are, right? Finally being recognized that we're just not counting pills every day. And the physicians that we talk to, some of the providers that we talk to, some of them recognize that, but actually explaining to Medicaid and these MCOs to also understand, it's amazing. It gives me hope for the future for our industry, and also help us bridge the gap, because some of these services that we actually give are cash, and not every patient can afford cash, right? To get time on my calendar to talk to me for 15 minutes. But there are a lot of Medicaid patients out there that will benefit from this service even more. So on behalf of me and other community pharmacists in Pennsylvania, this is exciting, and we're getting more information every day, thanks for the leadership of PPCN in guiding us with credentialing. I know Dan was talking about it. Some of these are not even easy for us to stop what we're doing and try to figure out what we need to do. But we have a team here in Pennsylvania. They read it and then summarize it for us.
That's excellent. And Chichi, I agree with you. Getting the system, and we're talking about the providers, patients, everybody within the system, the payers, to really recognize for the services that we provide, it's a journey.
Mm-hmm.
But I tell you, the journey that you guys have had is because you're putting the things in place within that journey, to, again, the data, the evidence, that you earned the right to become a provider. So I think that's just very exciting. And Chichi, I want to come back to you because you have a story about how you became part of Vaccines for Children program in Pennsylvania and how you broke some barriers to make this happen. Can you tell us that story?
You sure you have enough time today to hear the story, really? I mean, during the pandemic, when all the other vaccines, COVID vaccines were being rolled out, we noticed that there were gaps in communities, especially the under-resourced and underserved communities, where catch-up vaccines, like something as simple as meningitis or Tdap or polio, was not available for them. And I applied to be a VFC provider. I looked it up and I saw that as a VFC provider, you can get some of these vaccines from the federal government. And I didn't hear anything for a long time. And then I followed up. They said, you're a pharmacy and pharmacists cannot be VFC providers. And I said, I have over 500 students that need this vaccine. So if I can't do it, can you get somebody to do it for me? But thank God for PPCN, because I don't know who Stephanie McGrath knew behind the scenes, but she got somebody from the CDC to talk to me, and I explained it to them, and they moved my application from 1,000, the number 1,000 something, to number 1. And they gave me provisional acceptance just to do a pilot program. And the good news about pharmacists is that we are very thorough, right? And we do things and we do it well. So we knocked it out the park, and we're still VFC providers till today. But I tell you, it could be discouraging because the first year we didn't know what we're doing with billing, with documentation. But one thing we knew we had was we were able to give the patients their vaccine, the right vaccines at the right timing, right? Some vaccines might be 28 days apart. We're clinical pharmacists. This is what we do, right? The billing part, it took us over a year to figure it out. But it took us working together as a team, not only my pharmacy, but also with these organizations, right? To try to figure out the best way for accountability, efficiency, protecting my business and scaling it. And look at us now. Medicaid has also opened it up where we can bill for the administration fees for these. And then with this provider service that we have, I mean, Randy, I'm making it sound so easy because I'm summarizing it, but it took advocacy, right? Bothering Pennsylvania Department of Health, bothering DHS, and just trying to prove to them that we are the most accessible healthcare professionals in any community. So if you want something to be done right, you got to do it through pharmacists, right? And with this new provider status that we have, we can also bill for the counseling. Somebody can come to my pharmacy for just Tdap and MCV, meningitis, right? And we're looking through their profile and realize they also qualify for HPV, and we're counseling them. And it's COVID and flu season, we're counseling them. Nobody's paying us for that. But with this new recognition, we can bill for that, right? And some kids show up with 7 papers from different medical records from different states and country, and have to figure out what polio means in Russian. And nobody's paying us for that time. So I am excited to where we're going. I'm excited about this opportunity, and I can't wait to come back and share more.
I'm excited for you as well, too, about being one of the first pharmacies in Iowa to be a VFC. They didn't know what I was as a pharmacy, so it took some education and things like that. So I appreciate you kind of leading the way there for pharmacists as well. Stephanie, I'm going to come back to you now. And so now pharmacists can be providers. The next question is always, how's it really happening? So tell us about the implementation, the credentialing, the services as part of the Pennsylvania Pharmacist Care Network.
Sure. Thanks, Randy. And I don't know about Dan, but when we sat in a meeting with our Pennsylvania Department of Human Services, and the team said, as of March of 2024, we would like to recognize pharmacists as providers or allow pharmacists to enroll as providers. I almost fell out of my chair because I honestly didn't think that day was ever going to happen, let alone, have an actual date. So here we are almost a year later, and we've done a lot of learning over this last year in partnership with many pharmacy organizations. We still continually, this task force still continually meets with Pennsylvania Medicaid to address bumps in the road throughout this process. So in Pennsylvania, pharmacists must first enroll with the Medicaid fee-for-service program, which I'm sure is similar, to other states. But in Pennsylvania, only 5% of Medicaid recipients are actually covered by fee-for-service. The vast majority are covered by managed care. And as Dan described, there are 7 managed care organizations in Pennsylvania with 7 different processes for credentialing. And there's not a centralized credentialing system in Pennsylvania to do this. So the pharmacists, just like every other provider, have to be credentialed with all 7 MCOs and complete 7 different credentialing applications, which, as we've described, is very, very time consuming. It's very confusing. It's a square peg in a round hole for pharmacists. The questions were not made for pharmacists. Many of the questions don't apply. So we're continually trying to get clarity on what do you really mean here, for a pharmacist, because we don't have admitting privileges, and what does this mean? So there the However, despite some of the challenges we've had in Pennsylvania, just kind of overcoming, some of these learning opportunities, we have been able to collaborate with our CPSN colleagues from across the country. So specifically, our CPSN Tennessee colleagues shared some of the resources they had about CAQH credentialing, which has been very helpful for us, just to kind of get over some of those humps, and has provided a nice opportunity to collaborate with other CPSN networks and all continue to learn together. And so at the network level in Pennsylvania, we've established connections with all 7 MCOs to gather information, guidance, to pass along to Chichi and our other pharmacists, and also have this ability to troubleshoot the credentialing process on behalf of our pharmacist providers. I got stuck, or I haven't heard back from this health plan. Do you know what's going on? Can who should I reach out to? Who should I contact? So we're trying to navigate some of that, or help to navigate some of that, because while it's new for our pharmacists, it's also new for health plans to credential pharmacists. That was a huge key, in learning and overcoming some of those barriers as well. We're also currently working with pharmacy profiles to develop a process to facilitate the credentialing process on behalf of our network pharmacies. We're in early stages of that, but again, learning together with pharmacy profiles with CPSN on how we can facilitate that. PPCN has devoted many resources to supporting pharmacists through the credentialing process. We've held numerous webinars, enrollment boot camps, medical billing education sessions, and have devoted our Flip the Pharmacy initiative this year to the establishment of medical billing services. One challenge we have is that PPCN is a network of pharmacies, the billable billing entity, and it's the provider, the pharmacist, who have to be credentialed, and we all have to speak this language. There's quite a bit of learning and adjustment in that transition as well. We did start as a network of pharmacists. Going back more than 10 years ago, going back to our roots, we were a network of pharmacist providers, and have evolved over time, and we're kind of back to the beginning. But it's been what we've been working towards as a profession for decades, and we're living this complex, messy reality that's the pathway for sustainable pharmacy services in Pennsylvania. So we've been at this for about a year now. We're making progress every day. We've had pharmacists successfully submit medical billing claims and be paid. So we do have to stop and celebrate that. But we also keep moving and pushing our pharmacists forward towards the starting line, because we know that this is the future for our profession and the only path forward for pharmacists in Pennsylvania.
That's awesome. And I really do believe, provider status, we're trying to get at the federal level, right? But we're really making it work within the state level. But it's the relationship that you've had with these partners, such as your state Medicaid program, and then all the, many years that you provided them with services and demonstrating that value to them. So I just think that's really cool. And I think the credentialing, we're going to be, we got to start looking at how we get paid outside of just dispensing medications. So this is going to be the future. This is going to become the rule, not the exception. It's just that we got to work through this stuff initially here. I'm going to go back to Dan. Dan, how have pharmacists within Geisinger been about to implement services?
Yeah, it's been a long road at Geisinger with regard to our ambulatory and kind of billable services, and to kind of give you a framework, we've had pharmacists embedded in clinics in Geisinger for probably close to 30 years now, starting out with anticoagulation, and now there's a multitude of ologies and family practice and primary care that we're in, and functioning off of kind of this value-based care model that we try to model. So many times it's not just, what is the dollars that we're pulling in, but where I'll tell you it helps is when you get into the conversations and someone says, well, where do we need to save money within the system? And they look at the bottom line and it says, well, pharmacy is costing us this much. And they don't necessarily go to see what is the back end dollars that are saved. We can now mitigate a little bit of that by saying we are bringing in these dollars. But the expansion for us, I think, is going to be in the community pharmacies that we offer as part of our system. They are embedded and connected right to physician offices. And they're collaborating with the physicians that they're working with, but they weren't really seeing patients as our embedded pharmacists were doing. But now we have opportunities to catch those patients for tobacco cessation counseling. We have the opportunity, as Chichi said, to talk to them about, well, what immunizations do you need? You may not have spoken with your physician about them today, but let's do an assessment and see what we can offer for you. Or, boy, you have 20 different medications filled here from 6 different specialists. Let's sit down and do a comprehensive review of your medications to make sure that there aren't things that you don't need or things that are missing or interactions that could be causing some things for you. So we're fortunate that we've had a pretty expansive and robust pharmacy service, but this has allowed us to expand even more, to give more pharmacists on our team the opportunity to be involved in that direct patient care and have that impact. And as Chichi said, do more than just, feel like they're relegated to just dispensing medications. And now there's that validation of the services that they were providing otherwise. Now it means something to them, it means something to us, and it means something to the system.
Great. And Dan, one of the questions I want to follow up with you is, you got the embedded pharmacists that are doing great things.
Yeah.
Then you get your community pharmacists, community-based pharmacists that are doing some great things. How do you communicate within your system so that the pharmacist is embedded, I guess more of a intra-professional communication?
Yeah. And can I clarify, you saying communicate with the other health professionals or just among pharmacy?
I think I think other healthcare professionals, but I think in particular, pharmacists working together to help patients optimize their medications. I got to assume that, bringing the community pharmacists who's seeing some things very uniquely versus the embedded pharmacists who's seeing something else, putting those two things together, that's a powerful look at the patient from a medication perspective.
It is. We've developed practices over time that where the communication between pharmacists in different practices and different settings is natural. It's almost like we don't have to remind people to do it anymore. It just happens. The other thing that helps is all of our care areas are functioning on the same EHR. So whether you're working in one of our community dispensing locations, or you're working embedded in a clinic, or you're working in the hospital, or you're working in our home infusion area, wherever it is, they're all working through Epic. So the ability to message back and forth and use kind of predetermined, dot phrases or quick text is really helpful. We've got a really nice IT and informatics group that we work with as well, that when we identify something that should be carried out for everybody, they help us automate it. So when we identify a patient that needs 3 different touch points, I might just have to hit one button and those 3 different touch points to other pharmacists happen. So we're really utilizing technology. We're utilizing the system to make sure that we're offering comprehensive patient care. And I say that like we are certainly not the only ones, right? From an ambulatory care standpoint in Pennsylvania, the health systems, we have ongoing meetings with ourselves and Penn and UPMC and Allegheny and all of the other, Jeffersons and the Lehigh Valleys and the St. Luke's of the world to say, what's going on? What are you all doing to enhance patient care? And we kind of call it our therapy session on the couch once a month, every Monday, when we talk about Medicaid and these things to figure out how we could now leverage this to really improve the care that we're offering the patients we care for.
Fantastic. Thank you. Chichi, I'm coming back to you for the last question. What do you think the future of these services can look like in Pennsylvania and beyond?
The more we continue to utilize all the opportunities given to us, the more they're going to give us, because the more they're going to realize that we are built for this, right? The fact that we're willing to be innovative, creative, and not afraid to keep pushing, right? And you can't harvest what you didn't plant or sow. And we've been sowing and cultivating for years. And some of the things that we're doing today it didn't just happen just like that, right? We've been working and building, and we've been patient. So the future is so bright. The future, like just hearing what Dan is sharing, and the fact that pharmacists are that glue that binds providers together to make sure that care coordination is the way it should be, it's impressive. It's not easy. The fight is not easy, but I mean, to be a warrior and have battle marks, but the future of our profession, especially in our state, is beautiful. Being able to be reimbursed for things that we already do, whether it's point of care testing or long-acting injectables or vaccines or med reconciliation, anything it is that I do with my patients, just giving them a hug, right? And making them feel good. The future is bright for us. So as we struggle, we'll continue to keep planting, sowing, and harvesting.
Very good. Well, I want to thank our colleagues from Pennsylvania for sharing their inspirational message about pharmacists working together to attain provider status as free payment for their services. So thank you, Dan. Thank you, Melissa. Thank you, Chichi. And thank you, Stephanie. And thank you on behalf of the profession for helping lead the way to show pharmacists and the profession how we can get a provider status, but building that relationship with these partners of ours that can then help us achieve the goals that we're trying to achieve. And I want to thank all those who are listening. Thank you for listening to another episode of RX Inspirations. We look forward to providing you with more inspirational stories of pharmacists and how their great work is making a difference for their patients and our profession.